Hello everyone. My name is Dr. Christopher Vogelmann. I'm a practicing chiropractor here in Rockville, Maryland, and with offices in Alexandria, Virginia. And today I'd like to discuss a little bit about shoulder pain. Many of us have shoulder pain. In fact, I have personal experience with shoulder pain, having dislocated my shoulder in the middle of a skydiving incident about 13 years ago. But what I found over the years in working with patients, in fact my last 22 years in practice, is that many people's shoulder pain problems can be helped through gentle chiropractic care. Now, there are many causes of shoulder pain. Perhaps you've had a trauma, not necessarily a skydiving accident, but perhaps you've been working and you fell off a ladder injuring your shoulder, you had an old sports injury, perhaps you were playing tennis or football or something in the past, and now, maybe decades later, your shoulder is beginning to bother you. Well, one of the most interesting things about shoulder pain is that it is affected by the nerves coming from the brain, through the spinal cord, through the neck. In fact, in the lower neck, your lower cervical spine supplies all of the nerve energy to your shoulder, arm, and hand. Other causes of shoulder pain could be repetitive stress disorder. Perhaps you're chained to a computer or doing a lot of desk work, or you have very, very long commutes where your head is sticking forward, pulling on the muscles of your shoulder. Now that's very easy to understand when you think of the head basically being similar to a bowling ball, about a 10 to 14 pound bowling ball that's sitting upon your neck, which is like a Slinky. Now the neck has a lot of flexibility, but there's not a whole lot of stability. The shoulder is a very complex joint, and it can be affected, as I said before, by the nerve energy coming from the neck down into the muscles and joint of the shoulder. If you think of those nerves coming down from the neck, sometimes they're very similar to my finger. And how would this be affected? Well, think of my finger as a spinal nerve, and think of this rubber band as the misalignment in your spine, which is causing pressure on that nerve. In this case, turning my finger to a lovely shade of purple. Well, in chiropractic, we seek to remove that interference or that misalignment. And just as circulation is being restored to normal to my finger, so too do we restore normal nerve energy to the muscles of your shoulder. Other possible causes of shoulder pain can be congenital. Perhaps you were born with a malformed shoulder. And that's something that even that can be helped by chiropractic care if you've already had shoulder surgery and are still feeling the pains. Many of the old injuries too can be supplemented by having trigger points, little nerve bundles or knots in the muscles of your rotator cuff. And we treat those with very gentle pressure and get very good results. Now, I have a unique position here in the area because not only have I graduated from Harvard University with a bachelor's in psychology, but I have a great deal of postgraduate education in radiology, orthopedics, as well as in neurology and nutrition. And if there are nutritional supplements that can supplement our chiropractic care, or physical therapy modalities that we can use that are state-of-the-art, we will use those to get you out of pain as quickly as possible without the use of drugs, needles, or surgery. Now, if this is something that interests you, let me let you know that we keep our fees very, very simple. I charge $50 for an initial consultation, and occasionally we will run specials. Now, if this is something that interests you, and if it's something that you would like to ask more questions about, please feel free to contact me at the Rockville telephone number, which is 301-881-1110. Once again, that's 301-881-1110. You can also reach me in Alexandria at 703-619-1002 or on the web at www.drvogelmann.com. That's DRVOGELMANN.com. Thank you for listening, and I look forward to hearing from you soon.